All right, today we're going to talk about nosebleeds, how to prevent them, and unfortunately, if they occur, what to do to treat them. So I'm going to use this sheet, which is on my website. This is something you can refer to. The website is markyantamd.com or Alpharetta, alpharettaent.com. And then if you go under patient information and then patient handouts, you'll find the sheet that we're going to talk about. Number one, prevention. A lot of nosebleeds can be prevented. Drink a lot of water. Nosebleeds are very common when we get dried out, especially in the winter time. If the heater is turning on and even the air conditioner to a degree, make sure that all of your membranes are being kept moist by drinking enough water. The other thing you need to think about is blood pressure. Blood pressure is huge. If your blood is pumping hard through your nose, it's going to be very difficult to stop a nosebleed and prevent a nosebleed as well. Another thing is any other medications that are blood thinners. A lot of patients are on long-term therapy because they've had stents put in their heart or something else, but things like aspirin, Motrin, ibuprofen, all those things will also increase your risk of bleeding. Try to limit those to the degree that you can, of course. Keeping saline nasal spray in your nose is always going to be helpful, just to keep it moist, keep it from getting dried and cracked. And then humidifiers, you can run a humidifier at night, especially a cool mist humidifier. That's listed in this. There's another really nice product, AYR gel. There are a number of other ones though that you can use that are over the counter that'll help. Now, it's not always going to work. So what are you going to do if and when you get a nosebleed? So first thing to think about is, where is the blood coming from? Typically it's coming from the septum, the dividing plate that's between the two sides. So that's what you want to target with Afrin or any other decongestant nose spray. So make sure that if you're a frequent nosebleed sufferer that you do have some Afrin decongestant nasal spray on hand. Remember that it is addictive. After a few days of use, you get a rebound, okay? When we use Afrin for nosebleeds, what we're trying to do is aim to the inside, again, along the septum. It doesn't really matter whether your head is up, down, or wherever. What you want to do is get the spray aiming to the inside a little bit, okay? And then once that spray is in there, and of course if you have to clear out any clots beforehand, do that. You want to get your thumb and press as much of the side wall against your septum as you can, and give it a good 5 minutes or so. If it's a child, of course, you're going to have to do this for them, okay? Press that side wall, let your body form a clot inside there. Release after 5 minutes or so. If it's bleeding again, you might have to repeat it. Of course, if it's persisting, you're going to have to, depending on how severe it is, go to the hospital, call our office, but hopefully following these guidelines will help minimize the number of nosebleeds that you get, and you'll be educated in how to treat it. Thanks.